Welcome, welcome, welcome to another Live at 5. And this is the first time we're going to have an invited guest. Catherine Golden will be joining us from leaf411.org. And I've been so excited about it. So people are coming on. Hello, Pam, Jackie, Nanny, Pammy, yes. And it looks like Catherine's actually joined. I'm going to send her an invitation. Pam, Claire, hello, everybody. Thank you so much. I've been so excited. I've been announcing it, so thank you for receiving my stories every day, letting everybody know that Catherine's going to be with us. So I think everybody knows that I'm a big proponent of the use of plant medicine when it's used correctly and safely, and that's part of what Catherine's going to be sharing today with you all, is how you can do that for your loved one or possibly even for yourself. So we'll take just a few more minutes as people are coming on. Hi Mary, hi MJ, Morlock, Pam, KDA 19, Norway says hello, hello Brenda, Sue, hello, hello, Kastner 1656, hello, Little Sue, hi Suzanne. I'm so excited to see you all. So I'm going to give it just about another 30 seconds as people are coming on. Howdy from Penny, hello, hello, Mary Thompson, Stucky, hi there, and hello from Oklahoma, hello, hello. I'm so excited that you're all here. It feels like a party. So we're going, hello from Vermont, Suze, Rebecca. Thank you for giving me your names. I really appreciate it. I think I'm just old. I'm like, how do I pronounce these handles? So I'm so excited. Finland, oh my gosh. And hello from California. So we've got people from all over the world. It's so exciting, and all over the country. Nashville, Tennessee. Kelly, hi. So I'm going to bring Catherine on. I'm just going to introduce her, and then I trust we're going to have a lively conversation today. And just so you know, I'm going to try to pick up some of your questions as they come in, but we're going to be talking in general today about how Catherine can help you and how her organization can help you, rather than answer specific questions about your loved one, because that's what the nurse consult will be all about. So, okay, here we go. Hi from Southern California, Oklahoma, Connecticut, Aruba, from vacation in Aruba. Could we all join you, please? So, hi from the UK. I'm so excited. All right, I'm going to bring Nova Scotia. People are coming on. I'm so excited. So I'm going to bring Catherine on so we can get going. Here we go. Got the invitation from Dallas, Texas. Hello, Viv. Oh, the beautiful Gulf Coast of Mississippi. And here we are. Yay!
We did it.
I still get so excited when the technology works. I'm like, thank you, God. So,
It worked, Diane.
it worked, it worked. So we got lots of hearts coming. People have really been excited to hear from you, Catherine, and what your organization can do. So I just want to give you a little background so everybody knows that you have been a registered nurse with 27 years of experience. And we just celebrated Nurses Week last week. So
Yes.
thank you for all that you do.
Thank you.
I could just give all nurses a big hug. And you've been a cannabis educator. And
Yes.
so you founded leaf411.org. So you're the CEO and founder.
Mm-hmm.
And you also hold multiple certifications. You're a consult in Colorado, and you belong to a number of cannabis related groups so that you can stay up on the latest and greatest with plant medicine. So I have to stick with caffeine as my plant medicine, but but we're really anxious to hear about how your organization can help. So please, what prompted you to found your organization in the first place?
Yeah, great question. Well, I think, Diane, when you talk to anybody, especially medical professionals that get into cannabis medicine, usually comes from a personal story, and I'm no different. I'm always completely honest. I never liked cannabis. I tried it in my youth. It didn't work for my body at all.
Mm-hmm.
I believe the propaganda surrounding it. I thought, oh, everyone who uses it just wants to sit on a couch and, do nothing.
Yeah.
I was a nurse. I thought, well, gosh, if there was some medicinal benefit, we would know, right? People would be telling us. So then it was about 2017, my brother-in-law was suddenly diagnosed with stage 4 lung cancer and given 2 to 5 years to live. Two kids in high school. My family was devastated. Non-smoker, nothing, just out of the blue. Thought he had pneumonia, thought dealing for months, about 4 to 6 months, thinking it was pneumonia. Every antibiotic on the planet,
Right.
and they couldn't catch it until the very end. And then, so all of a sudden you go into overdrive when someone's diagnosed with something so suddenly like that. Everyone in your audience I know, feels this. Everyone's overwhelmed, the entire family. What do we do? Who do we talk to? So they luckily had resources in California that they could go to. And one researcher at USC said, we'll look at cannabis, but as a last ditch effort, because we know nothing about it. And this was 2016, 2017. Well, cannabis was huge here in Colorado at the time.
Sure.
I even voted against adult use here in Colorado because I thought, there's nothing of value. But once this happened, I thought, you know what, let me look at the validity of this science. I need to really look at it and see what all the hubbub's about. I started looking at the science, what medical professionals go to, all of our platforms, scientific platforms, and I was angry that I saw so much science of hope. And that's the key. There is a ton of science out there. So when someone says, oh, there's not enough science, not true, not true. There is an overwhelming amount of science. A lot of it is animal and lab model. Absolutely. Because we haven't had the access to do what the traditional
controlled trials,
right.
Which I have a pharmaceutical background, so it's sad to me that they don't do trials unless it's a regulated drug that they can profit from. So
so I was angry when I saw this science, that there is hope that this plant can be beneficial for patients. So then I started cannabis nursing, self-taught. What I noticed, the problem I saw was the affordability. All of a sudden, I was working at a holistic center as a cannabis nurse, and in a very affluent area here in Colorado, and people are still having trouble affording the $150, $200, $300 out-of-pocket doctor's appointment just to find out if cannabis was suitable for them.
Wow.
That's all they wanted. They just wanted the first basic questions,
right.
And then they had to afford the medicine. So I thought, wow, I could guide my brother-in-law how to start, where to start. But everyone should have a nurse in their pocket like me. I believe everyone should have a pocket nurse that they could pull out. You could just pull out and say, hey, where do I go to find this? Because nurses touch every aspect of patient care.
Yes.
We are like the libraries. We're the resources. We're the bridge to the physicians, to the nutritionists, to every aspect of patient care. And we know how to educate and guide you there. So I thought, well, what could I do? So that's where I started Leaf 411, which is a 501c3 nonprofit. I wanted to make sure that every single human had access to a registered nurse that was trained in cannabis. So we have a free hotline. It's going to always be 100% free for anyone. And then we have a personalized guidance call for a $25 donation. We spend 30 minutes one-on-one, so I can talk, or any of our nurses can talk to you, the family, the caregiver, the loved one, to say, okay, tell me what you're experiencing right now, what your intention is with cannabis. First, we talk about intention.
Okay, great.
And then we go from there. So that's where it all started.
Wow. Thank you for the effort to start a nonprofit organization. Not an easy thing, and then of course you had to get your staff, and get the word out. So I'm just delighted to be able to share what you put together with this community. And I used your service. In fact, it was interesting because and this is last year now, after my husband had been in crisis. He had a reaction to another medication. He's got Lewy body dementia, and as you know, they tend to be hypersensitive to medications and to pharmaceuticals.
Mm-hmm.
I didn't want, he was on 3 when he came out of a hospital stay last year, and I was like, whoa, I don't want to add anything else, but he wasn't on anything specifically for his anxiety and agitation, which I believe, as with many dementias, unfortunately, it's not a pure anything. I think he's probably got ADD. He's probably got some autism. He could have a touch of Parkinson's. I don't
Mm-hmm.
know. It's a mix. But I just didn't want to add any other pharmaceuticals. Now, in our case, he did use THC. He's a musician. was part of his lifestyle. We grew up in the 70s, you know.
Right.
So again, I confess I like it too. I
Mm-hmm.
don't use it anymore, but you know, I do. And and so the thing is I wanted to get him on it, but I was aware, like, oh my gosh, this is not when, you know, he used to do it recreationally. I want to take a structured approach so I know what I'm giving him. I know where to get it. I know if it has any interactions with the pharmaceuticals that he was on. So I actually got your number from a supplier
Mm-hmm.
online, a gummy supplier, and I was asking them questions. I'm like, you know what you should do? It's called the Sleep 411. So I did, and it was invaluable to
Thank
really, you
you.
know, talk through. And some of the things I was thinking, you were like, well, don't go that direction, go this direction. So, you know, so can you talk a little bit about like when somebody
Mm-hmm.
calls, you know, to be like you said, the hotline is wonderful, but if they want to get the most out of that half
Yeah.
hour, and I'm sure I know you would work with people if money was a real issue. I
Mm-hmm.
know you would. But to get the most out of that half hour, as you said, start with the intention. So I obviously they would want to be able to tell you the diagnosis, perhaps what symptoms they're seeing, and what they're hoping to get out of the treatment.
Yes, that's the key is that intention. What is your intention or the caregiver's intention with the plant? Is it to our main focus is integration, is adjunct therapy, meaning mixing them together. This first off, I want to say the idea of just throwing all the pharmaceutical side and going to plant medicine is not what any clinician will tell you to do.
Right.
It's always slow integration. Every human is different, every body is different, every system is different. So you have to go into it very slowly and with the intention of, okay, what do I want to treat? Do I want to, we usually say, let's pick one thing. Let's pick one thing because we want to measure the success of that
Yes.
one symptom is, and sleep
Yeah.
is huge, right? It's the sleep. It could be the irritability with dementia. It could be the aggression with dementia. It could be chronic pain. Things lead into one another. If you've
Yes.
got an underlying pain condition, that's going to disturb your sleep and that's going to make you irritable,
Sure.
and then there's also appetite. I mean, there's just unfortunately so many different aspects of dementia that you have to start picking one at a time, and then we tackle that one symptom.
Yes.
So that's why a 30-minute guidance call. So we're one-on-one together on the phone, and we take calls from all over the country, even all across the globe. We have so many international calls as well.
That's
and
wonderful.
it's fantastic. And so within that one call, we'll start it off saying, okay, now we're not going to cure anything in 30 minutes. We're going to go to step one in 30 minutes. So step one is, let me know, let's talk about the diagnosis. It's, if it's dementia, if it's Alzheimer's, whatever it is.
Sure.
And let's talk about the symptom
Sure.
first. Let's talk about which symptom is bothering your loved one the
The
most.
most. And as you said too, I mean, we have people in this community that are caregivers for other issues, right? It's not just dementia, of course, you know. So, like you said, chronic pain. And I'm going to pause just for a minute because a number of people are asking for the hotline.
I see
it's
that.
it's 1-800, correct?
Yes.
Leaf
No,
41. Oh,
it's no, it's close.
okay.
It's 844
Oh, thank you.
LEAF 411. So 844 LEAF 411, and then it's 844 So if you don't want to look at the numbers, and I give you,
Yes.
we'll give you the numbers as well as how to remember it.
And
So 844 LEAF 411. That is our hotline, and that's for simple questions like, how do I get a medical card?
yes. Sure.
Is there a nurse practitioner an advanced practice practitioner that I can go to in my state?
Okay.
Then those are those quick questions.
Okay.
Do I need a medical card? Those are those really quick questions that we could say, okay, that's a hotline question. I
Okay.
can answer that in like 5 minutes, 10 minutes. But if you want to say, okay, boy, I'm doing care. I'm caring for my loved one in my home, and here is a laundry list of symptoms. Those are those scheduled calls. So you can go on our website, leaf411.org, O-R-G, And then there's a big white let's talk button, click here, and that's how you schedule an appointment.
Great.
And that's a $25 donation. But if anyone has a financial hardship, please, they can call the hotline and say, I just can't do the $25, but I need to speak to a nurse. We take everyone. We never turn away anyone because we're here to guide.
Thank you so much. And so, great. And then let's back up to what we're saying though. So now the intention is so important. And I have to reinforce this enough because I know I was so upset when we were in crisis last year that I tended to want to throw the kitchen sink at my poor husband, to try to fix everything. And as you said, there are a number of things, that you can end up, like a number of things can benefit from the same dose of gummies, at least that's what I'm finding. But let's take one symptom at a time. As you said, get clear on the most important intention. And I would imagine you can break it down even to like, is it getting to sleep versus staying asleep?
Correct.
Is it an irritability? Is it, anger issues, and anxiety, so to the degree that they can describe, the symptom to you, I would imagine that would be helpful too, because, agitation and anxiety are a little bit different for me with Ben, and there's times when he's active, but not necessarily agitated.
Yes.
And I also have to ask myself, is the symptom bothering him or is it bothering me?
Right.
So two different ways to go. And as I said, I'm sure that, and we can talk just a minute about how, it could perhaps help the caregiver as well. So, but the intention being so important. Okay, great. And then obviously whatever pharmaceuticals they might be taking. Correct.
Yes. Yes. And we like to hear the pharmaceuticals, but what we like to remind our callers is that we're registered nurses. So we aren't practicing medicine, or a registered nurse doesn't do that. That's an advanced practice, a nurse practitioner, an MD, a DO. They practice medicine. So they're the ones that can say, okay, Diane, you can give Ben, 20 milligrams 3 times a day, and then, exact dosage.
Sure.
As a nurse, what I can do is I can say, okay, because, it's at our disposal, right? You can buy this online. You can walk into a dispensary. Whether you're in a medical only state, you can get a medical card, or if you're in an adult use state, 21 and over, you can use your driver's license and buy this medicine. So people are self-treating. They're desperate.
Yes.
They don't want to wait until the hospitals and the doctors are finally on board and say, okay, this is how you use it. They're like, no, I need to use it now because my loved one is suffering right now. Yes. I'm suffering right now. So they're going out to self-treat with this medicine. So what I can do as a registered nurse is I can say, okay, let's look at that starting dose. What does it say? So if you're here in Colorado and you go to a dispensary, the suggested serving size of a typical THC serving size is 10 milligrams.
Right.
Well, if you or I would take that, we'd be knocked off our rockets because
no.
That's a huge dose.
Huge.
10 milligrams is huge to start with, especially if you're cannabis, what we call cannabis naive. You haven't used it in a while or never, so we as nurses can say, let's take that starting dose and cut it into 4 pieces, 8 pieces if we can.
I'm thinking 2 milligrams to start, right? Like 2, 3.
Anywhere from 1. Actually, we try to, if we can get 1 milligram, we go there, because the older our bodies get, our metabolism slows down. Sure. So we need time for that chemical in our body to build up and kind of rear its head. So we want to make sure we start ultra low. And if I could get anything across to your audience today would be, you start as low as you can go, even 1 drop, because there are so many outliers. So you could have somebody that 10 milligrams does nothing to, and you're like, that didn't work. And they need 20, 30, 40 milligrams. Or you could be someone that, a half a milligram does wonders. Yes. And too much you would have thrown it out the window because you said it doesn't work. Well, we don't know who that outlier is going to be.
Sure.
So you start really, really, really low.
And as I said, patience, as I said, is I think every caregiver would like to be able to take patience in a pill, but like you said, going low and slow, and really, letting it build up gradually. How long should they give a certain dose? Like you said, and actually, a good question came in here. Does food in the stomach affect the rate of absorption with gummies? I have found that yes, it does.
Yes, it does.
And now, and tell me if this is, I don't think it's an old wives' tale. I always like to give Ben something with fat in it
Mm-hmm.
as a carrier for the THC. So if they're taking an edible, I tend to give it to him like some peanut butter and an apple, slice of apple,
Mm-hmm.
or some avocado, which he
Mm-hmm.
happens to really like, which is great. So is that true that
You are
it's
absolutely right. So what you are telling your audience, which is completely correct, is that cannabis is a fat soluble molecule. It loves fat, so it needs fat. That's how it sticks in the body, and that's how it works best. So typically, if you've been using cannabis with yourself or your loved one, and you are on a no-fat diet, and you don't eat very often or very much, and the cannabis isn't working, all we do is introduce some healthy fat into that, and man, you can see some changes. That can be one of the very first things you tweak. So yes, you are absolutely right. Cannabis loves fat.
yeah,
So you need it's accompanied with a healthy fat, like you said, peanut butter, a full fat
almond
yogurt,
butter. Mhm.
avocado, olive oil in a salad, something like if you're going to take it with dinner, you put those healthy fats in your dinner.
Yes, great. Okay, super. And so, and then how long? Now, as I said, I think for probably most of the loved ones that we're talking about here, the edibles are going to be better than certainly other ways that you can, ingest. About how long does it take for it to come on? So when should they, expect to see an effect?
It all depends on that food.
Sure.
So it depends on when you ate. So if you have an empty stomach, gosh, you can fill it in, anywhere from 30 minutes, 45 minutes, some people even sooner. If you have just had a meal, it could take anywhere to up to 2 hours. So that's where it varies.
Okay.
An edible is great when you want long lasting
Right.
effects. So someone has chronic pain, or like you mentioned earlier, Diane, you're so smart. You said some people have trouble falling asleep and some people have trouble staying asleep. If your loved one has trouble staying asleep, then you want something they can swallow, because swallowing, that route of administration, will last in your body the longest.
Right.
So the longer it takes to get into your body, absorption, the longer it's going to last. When you do inhalation, a lot of people like that for a quick relief, but yet that's quick in your body. It's going to be quick out of
Quick
your
out of the
body.
body.
So
Yeah.
so for something chronic, that's not usually a route that we go to. We go to something
Yeah.
edible.
Yeah. Okay, great. So let's thinking about some of the other symptoms that perhaps could be helped. So as I said, we've got sleep, we've got agitation and anxiety, appetite,
Mhm.
and I know and somebody else just said, can would it help somebody to want to get up and get out of bed in the morning? And I'm thinking, well, it kind of depends on why they don't want to get up and get out of bed in the morning, right? And this is why, of course, it's so hard to tell with dementia patients, because they can't tell you what's going on with them. That individual, perhaps they are in pain. Like, I know, like when I've had some different injuries, I didn't want to get up because it hurt to get up.
Right.
So, obviously, as I said, it's the kind of thing is challenging, when you don't know why somebody is having the symptoms that they are. So, but by the same token, again, my experience was that unlike some of the pharmaceuticals, there were no side effects when we were first, trying to find the right dose for Ben. At one point, he did get too much, and he fell asleep. I mean, it was like, he seemed a little out of it, and I didn't want to do that to him, but it's so, I mean, so if somebody wants to just try something, what is I hate to say, but like the worst that could happen?
To try something, and that's why I think it's very safe, because you will start extremely low. So the only negative that could happen at an extremely low dose is it's not going to
It just
work.
doesn't
You're
work.
not going to see any change. There's no lethal dose of cannabis. It doesn't work on the respiratory system that way. That's why it should be a first line drug versus a last line drug, because of the safety profile of the plant.
Mm-hmm.
But you start, as long as you're starting at minimal milligrams.
Okay.
And this is where, as an RN, we tell our callers, this is why, if you can see a nurse practitioner or an MD, a DO who can take your loved one into their practice, because then they see all the tests, they can talk to your other practitioners involved, and then they're designing your milligrams every day with the different parts of the plant, because that's how we haven't even talked about that,
No,
how
we have.
there's different parts of the plant, not
Yes,
just the world isn't just THC and CBD.
of
There are
course.
phenomenal other what we call cannabinoids, minor cannabinoids, acidic cannabinoids, that have shown promise to symptoms that dementia patients are suffering from. So there's an experiment. That's why there's so much experimental journey you can do with cannabis, because if one thing isn't working, please don't give up, because there are different blends of these
Yes,
parts of the plants, and the terpenes that go with them also have medicinal value and can bring on a different effect that I mean, we just got a treasure trove of what we can
start
experiment
to
with.
experiment with.
Mm-hmm.
And this question just came out. The CBN, we do use gummies that have a combination of the THC and the CBN and CBD. So Ben gets a healthy dose of the CBN, and CBD every day along with the THC. So we have found that to be helpful in kind of giving a more relaxing effect in the body, and doesn't knock him out. So cannabis, can it be mixed with other medications? My understanding is that yes, it can. As I said, in a good example is Ben. He takes three others. There is a website, I know that, and this might be something that you have, are able to help people with
Mm-hmm.
too, is just to ensure that there isn't an interaction with any indication, any products that they are taking, because the THC is the psychoactive part of the plant, of course, so.
Yes. Yes, so there are a couple things. So on our website, leaf411.org, there's a leaf library. It's free to everyone. All you do is have to plug in there uh, medication interaction or just interaction. And we have a page, what we call articles, that give you a few different
Oh,
resources.
great.
So and all you do is you plug in CBD, and then you plug in the medication that you're taking or your loved one is taking, and then it tells you what kind of interaction there is. Is there a mild, moderate, extreme interaction? What cautions do you need to take?
Okay, great.
Um, and like you said before, yes, you can mix cannabis with pharmaceuticals. Absolutely, 100%. It's all dose dependent. So when you get into those higher doses, and CBD is more the culprit. THC isn't as much. It's really
Interesting.
CBD fighting in the
Oh,
liver for
okay.
that same pathway. So they fight against each other. The pharmaceutical and CBD fight against each other. So CBD can actually block that pharmaceutical from being metabolized in the liver and hold it in your body longer. And then your doctor's like, wait, why is the blood level so high for this patient for this drug? Well, that's because CBD interacted with it.
Interesting.
Or it could you block it completely, and then it won't even or block it from even being metabolized. I mean, there's just so much that CBD can do that when you get into higher milligrams, that's when you have to be very careful.
Good.
Usually, typically, the over-the-counter suggested serving size doses of CBD, we don't have a concern. It's when we're getting into 100 milligrams a day
Sure.
or more. That's when there's like, okay, you need to check with your advanced practice clinician and see if there's an interaction.
Yes. Great. Thank you. And that, yeah, I didn't know that about the CBD.
Yeah.
So, I mean, well, there's a lot I don't know, but thank you. Yeah. I mean, I think typically we all think, oh, CBD's like the safe piece, so we tend to worry more about the THC. But yeah, in terms of the interaction in the liver, it's like, whoa. People are asking for the website, by the way. It's leaf411.org.
Yes,
And
correct.
and some people are asking about the low doses. We're talking about around 3 milligrams. We're saying 1 to 3 milligrams to get started with someone in terms of the
One,
THC.
1 to 2.5 milligrams is kind of most practitioners will kind of fall into to start someone 1 to 2.5. There are wonderful products out there that'll actually even set that up for you that already have that prepackaged for you, and it can be so easy that way. That's why when we were talking earlier about an edible, gummies or a tincture are usually more ideal than a chocolate bar that can crumble and
Yeah,
break, when you're trying to
exactly.
cut it.
I think
And
they're
some
a little
things are so
bit more
tiny.
gimmicky. I was going to say
Yeah.
some of them.
Yeah, it depends. So, once you find out that sweet spot, what we call the therapeutic window of the dose that works for that person, and you're like, okay, 10 milligrams works beautifully, or 20 milligrams of THC works beautifully for my loved one, then you can switch to a different product. But the gummy and the tincture, because you can cut a gummy into tiny, tiny
Sure.
pieces in a tincture by drops, that's what you use to find
By
that window, that
the
sweet
window.
window. Yeah, that sweet spot. And then once you find it there, then if your loved one says, well, I'm tired of taking this oil, it doesn't taste so great, then you at least know the milligrams. And then you can say, okay, now I can go to a piece of chocolate or
Great.
something that's different.
Great.
Yeah.
Super. Thank you. Yeah, that's a great, yeah. Well, I know we all know that Ben will eat his sweets and his goodies. So, and a question just said, I came in, should a patient see an additional specialist to use cannabis? I haven't felt that to be necessary. I told Ben's doctors that we were doing this, so when his neurologist and his primary care physician, I said, look, this is the way I'm going to go. And they were like, fine. So, and I know that some people have, I know in the comments during some of the videos that I've posted, they've said that their doctor doesn't, quote, know anything
Right.
about it. And a lot of them don't,
Right.
and so, but
Correct.
they certainly can't stop you from taking it. Like I said, I mean, it's really, it's your choice, for your loved one. And, let's talk a little bit about the whole idea about getting, do they need to get
Mm-hmm.
the medical marijuana card? I did go ahead and I live in Pennsylvania, so it's still controlled somewhat. I had to get the medical marijuana card for Ben, and I got the caregiver card for myself. But then once I found out, I did go to the dispensary. Once I found out what worked for him, though, kind of as you said, I get them online. So I mean, like, what are your thoughts about that? I mean, it was a lot easier than having to get to the dispensary, quite honestly. So
Right. Well,
the source, what are your thoughts about sourcing the products?
right. So I think it all depends on the complexity of the condition of the person you're treating. So if it's something that you're just saying, okay, it's just sleep, it's I only want to tackle the little bit of insomnia they have, and that's all you want to touch. Okay, great. That's where you can start with something either online or in a dispensary. You could call us, we can guide you on how low to start, in the whole, the tagline for the industry is start low, go slow. And so you do that, and that's why you're saying, yes, successfully you can do that. You don't have to spend the additional out of pocket to get counseled by an advanced practice. That changes though when the complexity
Sure.
changes. And now you're saying, gosh, I need to treat the disease. I don't want to just treat the symptoms. I've got to treat the disease. When you're doing that and there's cognition difficulties in place, and then there's now you've got a long laundry list of symptoms, that's when, for you as the caregiver, let's take that stress off your shoulders. That's what the advanced practice is there for. Don't instead of you, Diane, shouldering this and like, oh my gosh, I got to figure out the milligrams for my loved one. I've got to figure out, do I give it with food? Do I don't? All of this, they're there for you in that, just as in traditional healthcare, they're there for you. And yes, they're all across the country. There's a fantastic website called Society of Cannabis Clinicians. And you can type in your zip code and you can find a trained cannabis clinician near you.
Wonderful.
And they're out of pocket, and that's the affordability part that we try to guide on. Seeing if you can afford that, great, go for it. Take that weight off your shoulders.
Sure.
If you can't, and you're saying, I can't afford that, I've got to self-treat, that's when you need at least nurse guidance to say, okay, let's we're going to focus on harm reduction and safe use, and safe use and effective use. And that's how we can guide you on the tools that you can use. And like you were talking, okay, well, where do I source a product? Okay, well, that's where we can give you that guidance as well. I mean, I'm sure your community has seen all the news reports lately about they did an undercover kind of observation. I believe it was on Amazon, and gosh, I think it was over 50% of the products had either no CBD in them, very little CBD, more CBD than it said, THC when it said it didn't have THC. So it's the wild west for hemp products out there. So you have to be very careful. but there are amazing companies like some of the best are healer.com, healer, Healer, slash CBD.com, or healercbd.com, sorry.
Okay.
Dr. Dustin Sulak out of Maine is one of the number one physicians in the country on cannabis. And he has actually developed a line called the respite line for dementia patients. So for facilities, so that way they're blister packets and they're already dosed. Remember when I was saying
Yes,
that, you know, that little
right.
2 milligrams,
Mm-hmm.
they've got a daytime dose, they've got a nighttime dose. So you know, you're able to say, okay, facility, they're in blister packets. That's exactly what a facility wants to see. The staff just pops them out, gives it to them. They're low dose already with CBD mixed with THC, formulated by one of the top clinicians in the country. So that's where we can give you that guidance. There's other wonderful products that are oils that are out there that have different, like I was talking, minor cannabinoids, acidic cannabinoids that are mixed in. So if you're not getting anywhere with CBD and THC, don't give up, because there's so many different parts of the plant you can introduce.
Yeah.
And you can call us and we can give you all those companies that we know have lab reports that test for pesticides, heavy metals, toxins, because that's very important.
Great, thank you for, and by the way, I will follow up everybody, probably with a newsletter with some of this information that we're talking about, but let's at least give your hotline number again, because
Yes.
people are just joining us right now. So hotline, and again, everybody, this is for a quick question, 5 to 10 minute answer, and then the consult is a full half hour where you can ask specific questions for your loved one with just a $25 donation. And yet, if that's a hardship, Catherine's
Yep, just let
organization
us
will
know.
work
Just
with
say
you.
it in the voicemail, and we will give you a special code so it deletes that.
Yeah. So, but it's 844, right?
Yes.
Where's my brain? So 844 leaf 411 is
Yes.
the hotline, and leaf411.org is the website, which has the resources and where you can find out if there are any interactions with the pharmaceuticals they're on, and more, I'm sure, and where you can sign up to schedule a call with your staff.
Right. You can sign up, and even if you leave your email in our voicemail for the hotline, we will send you an email that has all of this. Like, oh, we'd love for you to schedule a call. If you can't, you know, the $25 is not doable, great, let us know. But if you can, click this link. We try to make it as easy as possible. And also on our website, one of the things that is brand new is it's been developed by our team of nurses, is a cannabis educational handbook, the Leaf 411 Education Handbook. It is gorgeous. It's a $10 donation, and it's a digital copy. So you could I just email it to you, and every page is colorful, and it tells you just basic stuff. It's so wonderful, and it's something that can get you started. So that's another really handy resource.
Wonderful. Yes, thank you so much. And I know this has already gone on a little longer than I thought. I didn't want to take up more than about a half an hour of your time, but maybe just for a couple more minutes.
I'm here. Sorry.
Oh, okay, you're still here. Oh, good. Just as we wind up here, what are some of your thoughts about the use for the caregivers
Yes.
themselves as they?
Yes.
So, can you speak to that? And there are a couple of we didn't actually talk about the cost. There are a couple of questions coming in. Let me just flip back to that for a minute. Costs really vary, obviously, depending on, if you're talking about a tincture versus gummies, versus food. Insurance, from my understanding, doesn't cover it. Do any states cover it, as far as you know?
Not yet. It depends. That's what I actually am working with the state of Colorado, and we're working with an insurer that's looking into covering medical cannabis for pain management for patients. So it's starting very slowly. There are some states that will that have allowed at least either workers' compensation insurance to cover for pain. It's starting very slow. So, but it's going to be a while before it gets to general coverage that will cover something like this. Affordability is tough. It's very expensive. And going back to, if you're just treating for one symptom and it's pain, or it's just insomnia, and you want to start, since the milligrams are very low, that's where you can save. call us, let us help guide you. And then once you get into the larger milligrams, then a medical card is necessary, because then you can actually save money in a dispensary once you get to the large doses.
Yes. Yeah, great. Thank you for that. So as we wind up here, as I said, I have had people say, like, what about those gummies for the caregiver? I'm saying, I look a little longingly at them when I give them to Ben. I must confess, as I said, that's not something that I've chosen to do right now. But can you speak to a little bit about
Mm-hmm.
how could it perhaps help some of what we, go through as
Yeah.
stressed out caregivers?
Yeah, I think the caregiver forgets about themselves, and that's what we like to promote as nurses is, we always ask them, let's make sure that your mind and body is healthy, because you're taking care of someone. So the stress that you're carrying, that can also be treated with cannabis. Doesn't mean you have to be impaired. No, I don't know of a patient on the planet that says, I want to be impaired, please impair me. They usually want a quality of life without impairment.
Exactly.
So you can do that. And you can enjoy cannabis and have the release of some of the symptoms that you're feeling, the stress. You can have the body calm down. CBD is a wonderful, what we call, it brings homeostasis. It brings a balance to the body. That's what CBD does. So the caregiver should, try CBD, and we can give you the starting doses on that too, and yes, share that medicine, because they're tiny doses. And as a nurse, you want to, and as a caregiver, experience what your loved one is going through. Say, I'm going to try this tiny dose, try it at night before bed, so
I
that way you're
did
in the
that.
safety of your own home. You're not going out driving,
No, no.
and you try it and you're like, wow. My mom says that. She's like, I can't put my finger on it, but I feel calmer when I'm using CBD. I'm like, yeah, it's great. She's like, but I don't feel like that, like, ooh, like a drug does you,
Sure.
like a Xanax does or anything. You just feel a little lighter, and that's a beautiful thing.
Yes, exactly. So I did do that one night. I think Ben and I looked at each other. We're like, "Whoa!"
That can happen. And then you just stay calm, you stay in your home, you drink lots of
Exactly.
water, cold lemonade, the limonene, there's, may help, so it's just to have some chamomile tea and just
Yeah.
relax, that the beautiful thing is it's not lethal. Even if you overconsume, it's just a lesson learned.
Yes, exactly. So we'll do one last question. How about a starting dose for CBD? We talked a little bit about starting
Mhm.
doses for THC. How about the CBD?
It all depends. So if you want, so CBD can be very alerting. So mind wake awakening. So if you are giving CBD to your loved one to sleep and you're like, why aren't they sleeping? And you're on a low dose, 5 milligrams, 10 milligrams, 15, 20, and they're not sleeping, it's probably because it's too low and it's mind alerting. When you get into the heavier doses, we're talking 50 milligrams, 70 milligrams of CBD, then you're starting to get sedating to work and help with sleep. So it all depends what you're trying to treat. See that intention. Do I want to just bring relaxation, but I don't want to be tired during the day? Well, okay, that could be 5 milligrams. That could be 10. That could be 15. But if you're saying, I want to sleep and I only want to take CBD, well, then you may need 50 milligrams, 70. So it all depends on what you're trying to treat.
Yeah, great. Well, and for those of you that are just joining, you may have to go back and listen to this from the beginning, because Catherine, you offered so much wonderful information, and I'm so very grateful. And just maybe just one more thing. You said it was this. Tell me the name of the society again, where people could look up if they wanted to talk with an advanced practitioner, or
Yep.
see if there was one.
See if there's one in their area. Society of Cannabis Clinicians, and they're a nonprofit as well. So it's societyofcannabisclinicians.org, and you just look under practitioners near me. You plug in your zip code, and then you can see if there's an advanced practice clinician in your town, or
Yeah.
how far you'd have to drive. And those are those out of pocket, but there's at least there's someone there if you can afford that.
Yes, exactly. So, well, thank you. This has been wonderful. And
Uh,
yes, by the way, this has been recorded, everybody. So I'll post the recording just as soon as we finish up. But I can't thank you enough, honestly, for coming on with so much valuable information, and for all the work you've done to put this organization together and to offer such hope for so many in a time when the world is a little nuts, and sometimes it's a little hard to find, but it sounds like there's a lot of room here and a lot of potential to help a lot of people.
Yes.
So
we're here to help. So call
yes.
us. We'd love to help.
Okay. So one more time, that number, everybody, for the hotline is 844
LEAF 411.
411. And the website is leaf411.org. Yep. Thank you again, yes, for your time, for your generosity. God bless you. And I'll be in touch myself again.
Yay. All right. Well, I hope your audience liked it. And I'm here whenever you need me.
It looks like everybody's saying it's a lot to digest. Yes, it is. But, everybody, one step at a time. Remember, one moment at a time, one step at a time. Take a deep breath, everybody. Me too. We can do this. Together, we're stronger. Together, we got this. We're saying that all the time, Catherine. So we consider you part of our team, you and your organization.
Yeah,
so
thank you.
Thank you all so very much. So this has been another Live at 5 with our first live guest. Our thanks to Catherine Golden. Thanks to all of your followers. You've been amazing. Thanks for coming on. We'll post this, and let's post the comments and how people have been helped going forward so we can share the information. So God bless you all.
Bye-bye.
Bye.
Bye.